Hi, class. We are focusing on week 4 right now, and I just wanted to talk with you about. I just wanted to talk with you about unprofessional conduct, and that I'm looking at the California Law book, the Basics book, the Caldwell. I think that's how you would say his name book. And just talking about unprofessional conduct, some of this may seem very obvious to you, and if you do, I mean, yes, a lot of these things are very practical, um, very obvious. However, therapists seem to get into these binds all the time, and it's very easy for us to say, oh, I'll never be in this situation. However, we get in these situations and then people lose their licenses. And so we need to be mindful of things that we shouldn't be doing, shouldn't ever get ourselves even close to these situations so we don't run into a problem. Okay, so I'm going to start off with chapter 3, and I just wanted to kind of highlight some of these things, because not always does unprofessional conduct lead to your license being revoked, but it could lead to a lawsuit, and some sort of penalty, even if it isn't your license or investigation. And we want to avoid that in all ways, right? Like, I don't want to be investigated, I don't want to be sued, and I definitely don't want my license taken away. So we just want to err always on the side of caution with the things that we do. The first area I'm going to touch on, which sounds very obvious, yet it happens, is sexual misconduct. Therapy should never include sex, okay? Now, definitely, therapy should not include sex within therapy, right? Like, so there should be no sexual relationship between a therapist and a client. There should be no sexual relationship between a therapist and a client's family member, okay? Um, your license will be revoked if you have sex with someone that you were treating within 2 years of seeing them, okay? For sure, your license will be revoked. Now, there never should be sex with a minor either, okay? And they even have made it so that if you get caught with having sex with a minor and they decide to lessen the charge for whatever reason, on a legal standpoint, the BBS has it written in here, in such a way that they can still revoke your license even if you don't get charged as a pedophile, okay? So we take that very seriously. There is a brochure we're expected to pass out if a client comes in and says that they had a sexual relationship with their last therapist, and it says professional therapy shouldn't include sex, and that's the pamphlet that you're supposed to like give to them. And you give it to them as them understanding that what happened is a violation and that it should never have happened. And it's a way of us like gently giving them that information. What they do with it is then on them to decide, but it's a way of us kind of saying like, this is unethical, that's illegal, that shouldn't have happened. Because some people sometimes have very skewed ideas of what therapy should include, and they're looking to their therapist and they look up to their therapist, and maybe they've fallen in love with their therapist or something, and it became some sort of emotional manipulation or unhealthiness, and they may have thought that was normal when in all actuality that's very abnormal, okay? um Again, impairment, this is considered unprofessional conduct. If you're impaired due to a mental illness, if you're impaired due to a physical illness, if you're impaired due to a chemical dependency, yeah, this shouldn't be happening. So this is something to be mindful of as we talked about, like looking at yourself and where you're at personally. Um, you should not have any other things getting in the way of you being present with your clients. And so if that's your own health, then maybe you need to take a step back and take a break. If you are realizing, you know what, I'm being too dependent on prescription medication, alcohol, under the influence of drugs, and again, this sounds obvious, but like everyone gets in situations. Like, I'm not saying this because I'm just like, oh, this is a lofty thing. Like, in the back of the CAMPT magazine, and CAMPT is California Marriage and Family Therapists. It's a great association to be part of. They have legal representation for you. Great association, really great way to protect yourself. In the back of every quarterly magazine, you see all the people that violate these things. So I'm not saying this because it doesn't happen. It happens. And a lot of times people don't even realize they're getting caught up. Maybe you go to lunch with a colleague and you have a drink and then you come into session and you're affected. That's going to affect you potentially professionally. So you need to be really careful. Getting a DUI gets you in trouble with the board. So these are things that you have. Domestic violence gets you in trouble with the board and potentially causes you to have your license suspended. So these are things to be mindful of and to be very cautious of with the choices and decisions that you make in your life inside the therapy room and outside of the therapy room. Clearly, if you're realizing, like, you're starting to get dementia, you are going to have to retire or take a step back, possibly be done, right? You have to be able to be coherent. You have to be able to be participatory in the therapy process. And if you're losing your mind, for a lack of a better term, this field's probably not the best field for you to be anymore. And it's at the cost of your clients. Okay. And there's consequences for those things. And your license being suspended or revoked. Okay. Committing a crime, clearly that's problematic. And again, especially ones that involve you being not able to function fully and not to be as responsible, okay, are going to definitely affect your license. Okay, so like I mentioned, something that's fraudulent, causing you to be like not trustworthy, drinking, domestic violence, something inappropriate with a child is going to definitely cause your license to be suspended or looked at and investigated. And you don't want to be in those kinds of situations, very clearly. You want to present yourself in a way that you're marketing who you are and where you're at, so that you also don't get investigated and have potential suspension. Don't say you can do a certain type of therapy and a doctor needs to do it. Don't be recommending medication when that's not your role as a clinician. You don't recommend medication. You're not a doctor. You shouldn't even be recommending vitamins. You shouldn't be recommending over-the-counter medication. You shouldn't be recommending oils. You are not a doctor. Leave that to a doctor. Somebody does something you recommend, they get hurt, you're on the line. Okay? So do not speak out of your scope of practice. Okay? That's very important. Don't say you're a doctor when you're not a doctor. I myself am a licensed marriage and family therapist. Some of you will call me Dr. Howdergy. I am not a doctor. I am a licensed marriage family therapist. That's very kind of you to assume that I'm a doctor, but I'm not a doctor. So you never want someone to call you. Now, I have, from a cultural perspective, I have some clients that call me Dr. Tony. And I'll say to them, I'm not a doctor. Just so you know, I'm not a doctor. I'm a licensed marriage family therapist. Just so you know, like, you may call me that, but that's not what I am. I'm just letting you know. And that is something that I stress because it's really important, and we don't want our clients to be misinformed, them think one thing and it's another. There's certain things that people with a higher degree can do that we cannot do, and we need to acknowledge that and accept that and not market ourselves to do other things. We can say we can cure stuff when we can't cure stuff, and that's going to get you in trouble. Okay, so don't do those things. Also, being mindful as you are transitioning from a trainee to an associate to then being licensed, there's a certain way you have to properly advertise yourself if you choose to advertise. You cannot advertise as if you're a licensed therapist, because you're not. And so as you're going in that trajectory and as you become associate, you still have to have your supervisor's name and license on your business cards, and you have to say you're an associate. You can't just leave that off, okay? Because that's false advertisement, and that's illegal and unethical, okay? Obviously, we don't want to be recommending or supporting people who aren't properly licensed. That would be a violation and problematic, because they're not who they say they are. And so that's something to be mindful of as well. We want to be honest in all testing arenas. We don't want to cheat on our licensing exam or law and ethics exam. That's going to cause a violation and potentially cause your license to be revoked. And then you could be disciplined by another board, and that again is going to come up and be a problem for your license. Confidentiality, we are expected to maintain it, and so we are held to the highest standard. If you have failed to maintain confidentiality, you may have as quick as a 60-day probation up to a 60-day suspension up to a 3-year probation for that. Something for you to be mindful of. You want to make sure whatever site you go to as a trainee that your supervisor is properly getting the right amount of CEUs to continue their supervision, that they are following all procedures and protocols for them to be appropriate supervisors, because otherwise, if they're not doing what they're supposed to be doing as supervisors, then your hours are not going to count, and your hours matter. So you need to make sure that that is getting taken care of appropriately, okay? And then again, with fees, our fees should be stated and should be very upfront. You cannot just kind of throw it in there. Your clients need to be aware of what they're signing up for. But again, it's something for you to be mindful of, okay? So you can't just like pretend like, oh, I just am letting you know now this is my fee. Like, they need to be aware of those things. And something's going on with their insurance, you need to be making them aware of it. You cannot bill for insurance if the client does not come. So that's where you need to talk to your clients about late fees and things of that nature. You don't get paid if they aren't seen. So you need to work that out with them, but you cannot bill for a time that they're not there. So with that being said, if you do that and you get caught, it's insurance fraud. Not good. Not good at all. Okay. So we want to make sure we're being honest and forthcoming. I mean, as a clinician, that should be something that we do. That should be something we want to be, right? So people will trust us. We're expected to keep good notes with sound clinical judgment. For that, at least that can cause at least a year probation, okay, if you don't do that and you get caught. And again, I keep saying if you get caught. Like, a lot of times people get away with things for years and then they get caught, or maybe it's their first time. I mean, some people are just unlucky, I guess. But at the end of the day, we want to be the best we can be and not even be put in these situations, right? It's kind of like with an affair in a marriage. People always say it happens. Well, and I believe that. It does just happen, but it starts off little things at a time, right? Maybe it's a text message. Maybe it's becoming friends with someone you probably think, maybe I shouldn't be friends with them on social media because this could lead away. Think before you do things, okay? Really evaluate. You work way too hard to get to the licensed position. You don't want to lose that over something you shouldn't be doing, okay? And you don't want to be in a lawsuit. Like, who wants to be in a lawsuit? They're expensive, they're time consuming. I don't want to be in a lawsuit. You don't want to be in a lawsuit. We want to avoid those things like the plague, okay? We want to avoid them. So we want to make sure that we are being above reproach, that we are shining examples of how we are supposed to be, okay? We don't want to have gross negligence or general unprofessional conduct, which is like not reporting our limits of confidentiality. You really feel for this family, you don't want their kid to be taken away, so you don't report. That's not your job. Our job is not to be judge and jury. Our job is to do our job. We're not to find out the information and really see if they should or they shouldn't. We just have to report. And we can walk our clients through that. And this can be a great therapeutic thing to walk them through. It doesn't mean you're going to lose your client. It could be great. But a lot of times we're fearful and we don't do those things. So we need to make sure that we are doing those things. And because you don't know if someone's going to get hurt, or you don't know if this has come up before or somebody else has reported it. And so we just need to do our job. Otherwise, we're going to get in big trouble. And we will have those kind of labels on us as general unprofessional conduct. Every time you register for liability insurance and things of that nature, this stuff comes up and they ask these questions. Have you been sued? Has the board talked to you about this, that, or the other? And you're going to have to answer those things. So this isn't something that just happens, you get in trouble and it goes away. It's going to kind of be there. And so you don't even want to be in that situation. Okay. So know the ethical standards, know the codes, know how things change, maintain liability insurance. You need it. Okay. I want to say even stick with organizations like CAMPed where you can consult an attorney when you have a question. I call them and I'll be like, is this okay or is this not okay? And they'll let me know. They're very straightforward. They're attorneys. They'll let me know. Sometimes clients put me in situations where I'm like, I'm feeling pressure, like I have to do this, and I may not actually have to. So I consult CAMPed and they'll reassure me one way or the other. Having the more support is beneficial. Address potential complaints, talk to your clients about them, keep good records, okay? And then follow the law even in non-professional contexts, right? So don't drink and drive. Don't be under the influence of anything. And you got to remember, there's room for debate and accusations. There's going to be an investigation. They're not going to just hear someone complain and be like, "Oh, absolutely, what they said is true and you're a liar." There's going to be an investigation. But just being in that situation is just stressful, and you don't want to be in that situation. I don't want to be in that situation. And so if we act in above reproach, and we try to do all the things that we're supposed to do, and we act above reproach even in our non-professional settings, hopefully we won't be in those situations. Just be cautious and careful, because your license is very valuable to you, and you don't want to be stuck in a situation where it's going to be questioned. Okay, so this is just part about this chapter. I'm going to do another video of the other 2 chapters that we're talking about this week. I just kind of wanted to highlight this first, and then I'll highlight those other things later. But I hope you guys have a great day, and I'll talk to you later.